What would you do if, right now, you felt a crushing pressure in your chest, and there was no one else in the house? Your phone is in the other room, and you have somewhere between 8 and 10 minutes before your heart starts taking damage that can never be undone. Most people who die from a heart attack die before they ever reach a hospital. And here's the part that should stop you cold. The majority of them didn't die because there was no way to save them. They died because, in those first few minutes, they didn't know what to do. So, in the next half hour, I'm going to walk you through 3 specific things doctors know, things that have actually saved lives, sometimes lives of people who were completely alone when it happened. But before I go any further, I need you to understand something. What I'm about to share isn't in the pamphlet your doctor hands you on your way out the door. It's not what fits into a rushed 5-minute appointment. It's what I would sit down and explain to my own father if I had to prepare him for the worst day of his life. So stay with me, because what you learn in the next 30 minutes could be the difference between walking away from this or not. Let me tell you about a patient I'll call Frank, 69 years old, retired. The kind of man who did everything right. Daily walks, careful with his diet, never missed a checkup. One ordinary Thursday, his wife stepped out to run errands. Frank was alone in the house. About 30 minutes later, he felt a strange pressure building in the center of his chest. He figured it was heartburn. He lay down on the couch to sleep it off. When his wife came home an hour and a half later, Frank was unconscious. What could have been a heart attack with a full recovery became permanent heart damage. He survived, but his life was never quite the same again. What failed wasn't his heart. What failed was that he didn't know what he was looking at, and that gap in knowledge cost him a piece of his heart, permanently. And Frank isn't rare. He's the norm. Heart disease kills millions of people worldwide every single year, and heart attacks alone account for a staggering share of those deaths. What troubles me most, as someone who's spent years studying this, is this: more than half of those people never make it to a hospital at all. And here's a number that should genuinely alarm you. Research consistently shows that the average person waits somewhere between 2 and 4 hours after symptoms begin before they even call for emergency help. 2 to 4 hours. When every single minute is quite literally counting against you. There's a phrase used constantly in cardiac care: time is muscle. Every minute that passes during a heart attack, your heart loses cells it will never get back. But today, we're going to break that cycle. I'm going to give you the knowledge to act, and act correctly, even if you are completely alone when it happens. Here's the part most people overlook. To understand what to do during a heart attack, you first have to understand what's actually happening inside your body. Because once you understand the mechanism, everything else falls into place. Let me give you a picture that makes this click instantly, one you'll never forget. Picture your heart as a massive city, full of millions of workers, the muscle cells of your heart, working around the clock, 365 days a year, without a single day off. To keep functioning, that city needs a constant supply of oxygen and nutrients. Those supplies travel in on special highways called the coronary arteries. Now, what happens when one of those highways gets blocked? Over the years, a substance called plaque slowly builds up along the walls of those arteries. Think of it like rust building up inside an old pipe. A little cholesterol, some inflammatory cells, some calcium, all forming a crust along the artery wall. For a long time, that plaque just sits there, stable, quiet, causing no visible problems. But then something destabilizes it. A spike in blood pressure, a wave of intense emotional stress, a sudden burst of physical exertion, and that plaque ruptures. And that's where the real drama begins. When the plaque tears open, your body reads it exactly like a wound, and does what it always does with a wound. It sends platelets rushing in to seal it. Platelets are like your bloodstream's emergency repair crew. They pile up rapidly at the site of the rupture and form a clot. The problem is, that clot doesn't repair anything. It completely blocks the artery. At that moment, everything downstream of that artery stops receiving oxygen. Millions of workers in that part of the city suddenly go dark. And here's what very few people realize. Heart muscle cells start dying within minutes, not hours. Minutes. At around 20 minutes without oxygen, the first cells become unrecoverable. At 40 minutes, the damaged area grows significantly. By 6 hours without intervention, a large portion of that tissue can die permanently, and that tissue does not come back. Unlike some organs, the heart can't regenerate what it's lost. What dies stays dead. Now you understand why every second during a heart attack is quite literally heart muscle you either keep or lose forever. Here's the good news, and I want you to hold on to this. Today, if you act fast, medical teams can open that blocked artery, remove the clot, and restore blood flow in under 90 minutes from the moment you reach the hospital. It's called primary angioplasty, and it can hand you back a nearly healthy heart. But to get that chance, you first have to get there. And to get there, you need to know exactly what to do in those first critical minutes, alone. But before I give you the 3 techniques, I need to ask you something. If this video is helping you, hit subscribe right now. I do this for one simple reason, so you don't miss a single health tip made specifically for people who care about living longer, healthier lives. Every week, I put out videos exactly like this one, built on solid evidence, explained the way you'd want it explained by someone who actually cares whether you understand it. Now, the 3 techniques. Technique 1. What I call the first 60 seconds emergency protocol. It isn't complicated, but it follows a very specific order, and that order can be the difference between surviving this and not. Step 1. Recognize the symptoms and don't talk yourself out of them. This is the single most common and most fatal mistake people make. Heart attack symptoms don't always look like what you've seen in the movies. It's not always a dramatic pain that drops you to the floor. Especially after 60, and especially in women, the symptoms are often far more subtle. What are we talking about? First, pressure or heaviness in the center of the chest, not always sharp pain. Patients describe it as someone's leaning their whole body weight on my chest, or there's a slab sitting on top of me. That pressure can last more than 20 minutes. Second, pain that radiates outward. It can travel down the left arm, the one everybody knows about, but also into the jaw, the neck, the back, or even the right arm. Frank, the patient I told you about earlier, described a dull ache in his jaw right before he lost consciousness. Third, sudden cold sweat, for no obvious reason. Your body breaks into a cold sweat when your nervous system reacts to your heart being in distress. That's a red flag, full stop. Fourth, nausea or dizziness. Many patients, especially women, experience nausea as their main symptom with little to no chest pain and write it off as indigestion. That mistake has cost lives. Fifth, a sense that something is seriously wrong. This sounds vague, but it's something people who study cardiac events see constantly. Patients describe an overwhelming sense of impending doom that the body itself generates. If you feel it, don't brush it off. And I want this to lodge permanently in your memory. If you're over 60 and you have risk factors like high blood pressure, diabetes, high cholesterol, or a smoking history, and you feel any combination of these symptoms lasting more than 5 minutes, treat it as a heart attack until proven otherwise. Don't talk yourself into believing it's a pulled muscle, or heartburn, or stress. There's one rule that governs this kind of decision. When in doubt, act as though it's the worst-case scenario. Because if it is, and you don't act, there's no undoing that. Step 2. Call emergency services immediately. This is the single most critical step, and I want to say it plainly. Nothing I teach you today replaces that call. Everything else is a bridge to buy you time while help is on the way. But the call comes first. Dial your emergency number. If you can dial while you're walking toward the phone, do it on the move. When they answer, say exactly this. I think I'm having a heart attack. I'm alone. My address is, and give your complete address, including floor or apartment number if you have one. The dispatcher is trained for exactly this. Stay on the line. Don't hang up. They can walk you through what to do in real time, and if you lose consciousness, they'll already know exactly where to find you. Here's a detail almost nobody knows, and it can genuinely make the difference. Unlock your front door before help arrives. It sounds obvious, but in the real world, emergency crews regularly arrive at a locked door with someone unconscious on the other side. The time lost breaking in can be decisive. So once you've called, go to the door, unlock it, or at least flip the latch, and then sit down. Step 3. The position that reduces the strain on your heart. Once you've called for help and unlocked the door, there's a specific position with real physiological backing. Do not lie flat on your back. I'll repeat that. Do not lie flat. There's a widespread myth that lying down is the right move. It's understandable. You feel awful, so your instinct says lie down. But during a heart attack, lying completely flat can actually increase the workload on your heart for very specific hemodynamic reasons. When you lie flat, more blood returns to the heart at once, and a heart that's already struggling has to work harder to handle that volume. The correct position is sometimes called a modified upright seated position, and it's simple. Sit on the floor or in a sturdy chair. If you're on the floor, lean your back against a wall. Bend your knees, and if you can, prop your legs up slightly. Let your arms rest at your sides. This position reduces what's called cardiac preload, the volume of blood your heart has to pump with each beat, and it makes breathing noticeably easier. Think of it this way. If your heart is a pump that's already failing, do you want to overload it further or help it do the absolute minimum work possible while the repair crew is on the way? The answer is obvious. Help it do as little as possible. Stay in that position. Try to stay calm. Don't try to walk anywhere. Don't call 10 different people. Save every ounce of energy for your heart. Technique 2. One of the most well-studied and effective tools available for managing a heart attack before help arrives. I'm talking about aspirin. And I know what you're thinking. Aspirin? That everyday pill? Yes, that one. Let me walk you through why it works, because once you understand it, you'll never look at a bottle of aspirin the same way again. Remember what I explained earlier? The core problem in a heart attack is a clot made of platelets blocking the coronary artery. Aspirin, whose active ingredient is acetylsalicylic acid, has a remarkable property. It irreversibly blocks platelet activation. It does this by inhibiting an enzyme called cyclooxygenase 1, which platelets need in order to clump together. In plain terms, aspirin tells your platelets to stop piling up. It shuts down the exact mechanism building the clot that's threatening your heart. The clinical research here is compelling. One of the largest heart attack studies ever conducted found that early aspirin use reduced mortality by roughly 23%. Almost 1 in 4 people who would otherwise have died survived because of a single pill taken in time. 23% from a pill that costs pennies. Now, you have to take it correctly, or you lose part of that benefit. How should it be taken? The recommended acute dose is 300 milligrams. A standard 500 milligram aspirin is too much, half a tablet can work. A children's aspirin at 100 milligrams may not be enough. Ideally, you'd have a 300 or 325 milligram aspirin on hand at home. And here's the detail that actually matters most. Chew it. Don't swallow it whole. Chew it. Why? Because chewing breaks the tablet down in your mouth, allowing partial absorption through the tissue under your tongue, getting it into your bloodstream far faster than if you swallow it whole and wait for your stomach to process it. We're talking about a difference of several critical minutes. Chew it like a cracker, then swallow. That simple. Now, the important warnings, because the details are what actually save lives. Who should not take aspirin? First, anyone with a known allergy to aspirin or NSAIDs. If you've ever had an allergic reaction to it, don't take it. Second, anyone with an active peptic ulcer or active gastrointestinal bleeding, since aspirin can worsen bleeding. Third, anyone already taking blood thinners, whether older medications or newer oral anticoagulants. Adding aspirin on top of those, without medical guidance, can significantly raise your bleeding risk. That's exactly why it's worth bringing up at your next routine visit with your doctor. Ask whether keeping aspirin on hand makes sense for you specifically. Let that be a calm, informed decision made ahead of time, not something you're figuring out mid-emergency. But if none of those warnings apply to you and you feel the symptoms of a heart attack and you have aspirin at home, chew it and you'll have bought yourself valuable time while help is on the way. There's one more thing I need to mention because I see it circulating online and it genuinely concerns me. There are videos out there recommending other painkillers, like ibuprofen, instead of aspirin. This is wrong and potentially dangerous. Ibuprofen can actually interfere with aspirin's blood-thinning effect, and some research links it to worse outcomes during a heart attack. Not ibuprofen, not acetaminophen, nothing else. In this specific emergency, aspirin is the only option backed by solid evidence. Remember that. Share it with your family. This next one might surprise you. Technique. 3 is probably the least understood and the one that causes the most confusion because there's a technique that's circulated online for years, passed around in messaging apps and viral videos, marketed as the technique doctors don't want you to know. I'm talking about so-called cough CPR, and I'm going to be completely honest with you about it because my job isn't to tell you what you want to hear. It's to tell you the truth. The theory behind cough CPR says that if you feel yourself losing consciousness during a heart attack, you should cough forcefully and repeatedly. The idea is that coughing briefly raises the pressure inside your chest, which might maintain a small amount of blood flow to the brain for a few seconds. This idea traces back to a 1976 medical paper describing a maneuver used in hospitalized patients being continuously monitored in coronary care units, applied by medical staff in the immediate seconds after a serious arrhythmia, a completely controlled clinical setting. What happened next is what usually happens on the internet. That narrow finding got stretched, oversimplified, and went viral, reaching millions of people as though it were a universal, do-it-yourself, life-saving technique. The reality is different. Major cardiology and emergency medicine organizations are unanimous. Cough CPR is not recommended as first aid for the general public during a heart attack, and there are solid medical reasons why. First, a heart attack and cardiac arrest are not the same thing. A heart attack is a blocked artery. Cardiac arrest is when the heart stops beating in any coordinated way. Coughing may have some theoretical role in the seconds before cardiac arrest, not during a heart attack itself. Second, coughing forcefully while your heart is already struggling can increase the heart muscle's oxygen demand and make things worse. Third, if you're already unwell enough to be on the verge of losing consciousness, you likely can't cough effectively anyway. And fourth, the most important reason, if you're spending time coughing instead of calling for emergency help, you are burning the most valuable resource you have. So, cough CPR is not Technique 3. Technique 3 is something different, and it's just as grounded in physiology. It's called cardiac load-controlled breathing. Let me explain why it works. When you're having a heart attack, panic is a completely natural response. Your brain detects a threat and fires up your sympathetic nervous system, the classic fight-or-flight response. That triggers a hormonal cascade, adrenaline, noradrenaline, and those hormones do exactly the opposite of what you need. They raise your heart rate, raise your blood pressure, and increase your heart's oxygen demand, which means when panic takes over, your already injured heart has to work even harder. It's like asking a car with a failing engine to floor the accelerator. Controlled breathing activates the opposing system, your parasympathetic nervous system, the calming system. Through what's called the vagal reflex, slow, deep breathing can lower your heart rate, ease your blood pressure slightly, and reduce your heart's oxygen demand. It's not a cure. It's not magic. But in those critical minutes while you're waiting for the ambulance, it can be the difference between a heart that's working less hard and one that exhausts itself faster. How do you do it? It's simple. It's called the 4-7-8 technique. In the position I described earlier, seated, back supported, knees bent, close your mouth. Breathe in slowly through your nose for 4 seconds. Don't force it, just gentle, like you're smelling a flower. Hold that breath for 7 seconds, calmly, without tensing up. Then, breathe out slowly through your mouth for 8 seconds, like you're blowing out a candle from 3 feet away, very slowly. Repeat that cycle again and again. 4, 7, 8. And while you breathe, repeat to yourself, silently, I've called for help. They're on the way. All I have to do is stay calm until they get here. That's not empty positive thinking. That's neuroscience. Your inner voice actually shapes your nervous system's activity. Research on acute stress and pain management consistently shows that people who maintain a calming internal script have measurably less severe physiological stress responses. Let me tell you about a patient. I'll call her Diane, 73 years old, living alone for 8 years since her husband passed. A retired teacher, remarkably sharp and prepared. She'd watched a video very much like this one and taken notes. She kept the emergency number saved as the very first contact on her phone. One Wednesday afternoon, she felt the pressure in her chest. She recognized it immediately. She called for help within 2 minutes. She unlocked her door, sat down in the chair by the entryway, and waited, breathing slowly the whole time. When paramedics arrived 9 minutes later, Diane was conscious, alert, and her pulse was relatively stable. They took her in, performed the procedure to open the blocked artery, and 72 hours later, she was calling to tell the whole story. She said something that stuck with everyone who heard it. The only thing that kept me calm was knowing exactly what to do. Fear didn't win because I had a plan. That's the power of knowledge. It doesn't erase the risk, but it gives you a chance you wouldn't have had otherwise. Before we finish, I want to walk through the most common mistakes people make during a heart attack, because sometimes knowing what not to do matters just as much. Mistake 1. Driving yourself to the hospital. Never, under any circumstances. If you're alone and think you're having a heart attack, don't get behind the wheel. First, the effort of driving increases the strain on your heart. Second, if you lose consciousness while driving, the outcome can be catastrophic. Call for help and wait for the ambulance. It arrives with monitoring equipment, defibrillators, and trained staff. Your car has none of that. Mistake 2. Waiting to see if it gets better. I've said this already, but it bears repeating, because this mistake kills people. If your symptoms last more than 5 minutes and match what I've described, don't wait. Don't convince yourself it'll pass on its own. Every minute you wait is heart muscle you're losing. Mistake 3. Eating or drinking anything. In the context of a heart attack, this can be a real problem if emergency surgery becomes necessary, since a full stomach complicates anesthesia. Nothing by mouth except aspirin if it applies to you. Mistake 4. Physical exertion. Let me see if walking it off helps. No, absolutely not. Physical effort increases your heart's oxygen demand. The last thing you need right now. Sit down, stay still, breathe. Mistake 5. Not unlocking the door. The time emergency crews lose trying to get into your home can be the deciding factor. Open that door before they arrive. Here's something most people don't know. Most heart attacks don't strike completely without warning. In roughly half to 60% of cases, the body sends warning signs in the hours, sometimes days, beforehand. These are called prodromal symptoms, and learning to recognize them can give you the chance to get help before the emergency ever happens. What are these warning signs? First, unexplained disproportionate fatigue. Not the tiredness from a long day. I mean a deep exhaustion that doesn't match your activity level, appearing fairly suddenly in someone who doesn't normally feel this way. Especially in women, this is one of the most common, and most commonly ignored, symptoms. Second, chest discomfort with exertion. If, over the past few days, climbing stairs, walking briskly, or carrying groceries has produced a pressure or heaviness in your chest that wasn't there before, that's a warning sign that deserves urgent medical attention. It's called unstable angina, and it's often a direct precursor to a heart attack. Third, unexplained shortness of breath. If everyday activities that never used to bother you now leave you breathless, your heart may be signaling that something isn't right. Fourth, unusual insomnia paired with anxiety. Research shows that activation of the autonomic nervous system in the hours before a heart attack can show up as trouble sleeping, or a vague, unexplained sense of unease. Fifth, frequent or irregular palpitations. A heart under strain sometimes generates irregular rhythms that feel like skipped beats, fluttering or racing, with no clear trigger. If you notice any of these, especially in combination, don't wait for it to pass. Call your doctor, go to urgent care, ask for an EKG. An EKG can reveal changes showing your heart muscle is under strain even before a full heart attack occurs. And in that window, doctors can often intervene and prevent the heart attack from happening at all. The best heart attack always is the one that never happens. I want you to walk away from this video with 3 things burned into memory. 1. If you feel the symptoms of a heart attack, call for emergency help immediately, unlock your door, and sit down with your knees bent and your back supported. Don't lie flat. Don't drive. Don't wait. 2. If there's no reason you shouldn't, chew 1 300 milligram aspirin. Chew it. Don't swallow it whole. 3. Breathe. 4 seconds in, 7 seconds hold, 8 seconds out. And remind yourself that help is coming, and all you have to do is stay calm. Those 3 things, Just those 3 can save your life. Here's something worth sitting with. The people who survive heart attacks almost always say some version of the same thing afterward. I wish I'd known this before. Today, you know it, and that, on its own, is already a victory. Share this video with someone you care about, your partner, your sibling, your friend who lives alone, your parents, because everything you just learned has no value if it stays right here. Its value comes from reaching more people. Where are you watching from? Drop it in the comments below. I'm Dr. David, and this is The Healthy Body, where every week I bring you clear, evidence-based health guidance to help you live longer, stronger, and with real confidence in how you care for yourself. If you haven't yet, subscribe now so you never miss what could be the video that changes everything for you or someone you love. This video is for educational purposes only and is not a substitute for professional medical advice. Always consult your doctor or a qualified healthcare provider with any questions about your health.